expression of her calling as a physician. She embraces the role of being there for patients and their loved ones during their toughest moments with a treatment philosophy based in compassion, empathy, and respect. After earning her medical degree at American University of the Caribbean, Dr. Carr completed her residency in internal medicine at West Suburban Medical Center in Oak Park, Illinois. She then began practicing hospital medicine at the University of Chicago with a focus on oncology. This work sparked her passion for providing holistic care with a goal of enhancing her patients' quality of life. This passion led to her pursuit of a fellowship in hospice and palliative medicine at the University of Chicago. Her recent research work involves launching a legacy project that aims to honor the life and dignity of patients. Thank you so much for being here with us today, Dr. Carr. Go ahead and take it away.
Hi, I'm having some internet problems, but can you see me and hear me okay?
Currently, yes.
Okay, good. Hopefully it stays this way. Thank you so much for having me. It's my pleasure to be here today. So we can have this discussion, and I do feel very passionately about the subject matter. And overall, holistic care is extremely important to me. I think like focusing on the patient as a whole person with multiple levels and domains of care is just so important in providing whole body care. So let me go into the presentation. So the objectives today in this presentation and integrative medicine, and it'll be abbreviated as CAIM in the presentation moving forward, to define what integrative medicine is, to discuss evidence-based integrative medicine, and discuss resources for patients, caregivers, and for providers. I do not have any conflicts of interest. All right, so into in detail moving forward. So the first category is nutritional or natural products. And these include things such as special diets, dietary supplements, herbs, and probiotics. Various others. I've just named a few over here. The other category is psychological and mind-body. And this includes things such as meditation, prayer, and mindfulness. The next category includes physical or body-based. And these include things such as massage, spinal care. For example, yoga therapy, dance therapy, art therapy, and also traditional Chinese medicine such as Tai Chi, Qigong, or acupuncture. There's also Reiki and relaxation techniques such as breathing exercises and guided imagery. So the 10 most complementary health approaches amongst adults. The most common was natural products, second most common, deep breathing, and then yoga, Tai Chi, Qigong, chiropractic or osteopathic manipulation, meditation as the top categories. So I wanted to have this definition here so that we can define exactly what the differences are. These words are thrown around quite a bit. It just sort of scratched my head like, okay, but what is it that I should do, or what should I talk about with my patients or with even my family regarding these. So the first one is conventional medicine, as we all know, and this is Western medicine. It's a system of medicine that treats the disease and symptoms with drugs, surgery, radiation, and similar practices. And then the next one is alternative medicine, which is a range of medical therapies that might include homeopathy, acupuncture, herbalism, and others. Conventional medical approaches, and it's a hybrid approach. The next one is functional medicine, and this is scientifically based approaches that focus on disease roots and prevention with treatment for the patient rather than the illness. And the final category, the one we'll be going into more detail, is integrative medicine, and this combines the first category of conventional medicine and the second category of alternative medicines in a coordinated way. Focused. So this means ensuring that there has been research conducted in these. So what is integrative medicine? And this combines with conventional treatments for cancer to help patients cope with symptoms and side effects of treatment. It is a holistic modality that delivers evidence healthcare professionals to achieve optimal health and healing. So what are alternative therapies? And this is, this slide goes into a very brief description of this. And this is if a non for example, people that use things like certain herbs or infusions instead of traditional medicine like chemotherapy, that can be considered an alternative therapy. And these alternative therapies are usually not researched, they're not studied, and or they might have even been disproved. They do not in having the result that people are hoping to achieve, which is their cancer. It might even be harmful, might even act with utilizing Western medicine along with this. So whole person health is very important when treating anyone with any disease. And this means helping individuals, families, communities, and populations improve and restore their health in multiple interconnected domains, which are biological. Research on whole person health includes expanding the understanding of connections between all these aspects and including connections between organs and body systems. So this slide includes, I always love visuals. So this slide includes a visual of what we call whole person care. The patient category all the way in the center at its core. And the patient's surrounded by their family. They were raised in a certain culture. They were raised in a certain environment that makes up that patient, their thoughts, beliefs, values. Surrounding that patient, if that patient has cancer specifically for this, we have other Western approaches, such as surgery, chemotherapy, immunotherapy, stem cell transplants, radiation therapy, amongst the 4 domains of psychological, social, spiritual, physical. And defining these a little bit more, we go to the physical domain, which includes things such as palliative medicine, nutrition, exercise, PTOT, sexual health, including, most importantly, I've outlined and read over here, integrative medicine, acupuncture, massage therapy, which is the point of this talk today. We also have our spiritual domain, which can be very important as well. Our therapy, yoga, meditation, and the social domain, which includes counseling, social work, support groups, etc. So why are we having this talk today? Through several different surveys that were done on cancer patients, I wanted to point out this particular study that was done at the University Hospital Mannheim in Germany. This was a survey that was collected over a 4-month period in 2018, and they surveyed 325 patients with biopsy-proven sarcoma, and they either had that or GI stromal tumors and also desmoid tumors. These made up the bulk of these 325 patients. And 51% of these participants integrative medicine in their lifetime, and 15% of them strictly during the treatment for their disease. So the patients then told us why, or told them why they used this therapy. And their number one reason was to boost their immune system. Next was to help them feel better. The next one was to cope with cancer treatment. The next was to reduce stress. And then lastly, manage symptom or side effects. So going back to the initial list I had, so highlighting the first part, which is nutritional or natural products, including special diets, dietary supplements, herbs, and probiotics. I am going to go into a little bit further detail on this. But like I said earlier, I always enjoy a little bit of imagery, and if it has some comedic value, I'm all for it. This is a doctor just talking to a patient saying he's going to take him off the herbal tree, and the patient appears to have some plants growing out of his head. Move on to the next. So I think activity for cancer survivors. This was one that was published in 2022. And the general recommendations that they had were, first of all, nutritional and physical assessment and counseling should begin as soon as possible after diagnosis. And then recommendations to improve long-term health and to increase the likelihood of survival. They recommended to avoid obesity and to maintain or increase muscle mass through diet and physical activity. And to the advice of the American Cancer Society guidelines for diet and physical activity for cancer prevention to reduce risk of a new cancer. So they also had guidelines for individuals that included the following: to achieve and maintain a healthy body weight, be physically active, for vigorous intensity physical activity, Obviously, with cancer patients, sometimes as you're going through treatment, it can be particularly hard to feel like you can do even minimal activities, such as walking around your room. This overall guideline is a guideline in itself, and that means that if it gives sort of an idea for patients on what they could be doing. So concentrates on patients that are they're not going to be harming themselves if they can do this. So this can be broken down over the course of the week as well, where you do 15 minutes of walking in the morning, 15 minutes of walking in the evening, and just breaking it down over the course of the week into 10 or 15-minute segments, or even less as you're able to. I usually recommend doing these activities during the part of the day where you feel most active. And for most patients, that's different. And sometimes in the evening. So just utilizing that peak time of the day where you naturally are more active to to take 5 minutes and even do seated exercises to try to maintain your muscle mass. So that's for adults. For children and adolescents, at least 1 hour moderate intensity or vigorous intensity activity each day. High nutrient density foods, eating a variety of veggies, fruits, whole grains. Get a with a nutrition specialist or the nutritionist that works directly with your cancer team to figure out what is good to eat, what to avoid. And going into that, avoid or limit red or processed meats, sugar sweetened beverages, highly processed foods, and refined grain products, and to also limit alcohol. So, um, I wanted to make sure to highlight this because it's really important to talk about anything that you take with your oncologist. And that's in bold and underlined down below. But this is because there's a risk of interactions. There could be increased toxicity from the cancer regimen, and then, or even the natural product themselves, risks of contaminants or toxins in non-regulated products. I do want to talk about a little bit, and this is particularly if you're going to buy a supplement at your local supermarket, you have no idea of knowing how much of the actual product in the label is in the capsule itself. So this means that there's actually several studies that were done that show that there's only certain percentages of those products in the label in the capsule, and there's a few companies that um, just consult with your oncologist before you use any of those products. So also another risk is that it can cause loss of efficacy for anti-cancer treatments. There's also very limited research on natural products. Next slide. So a few interactions I wanted to specifically highlight. It can interact with that. St. John's wort, very readily available on supermarket or pharmacy counters, and it can interact with therapies such as irinotecan, docetaxel, or imatinib. A green tea can interact with bortezomib, ginger, garlic, and ginseng. They all can affect coagulation, so they can thin your blood even more, and they also interact with therapies such as imatinib and docetaxel. So be careful of those. So speaking of ginseng, I did want to highlight this big trial that was published in 2013, and it was about Wisconsin ginseng in particular, not Chinese ginseng or any other ginseng. They particularly studied the specific Wisconsin ginseng in regards to treating cancer-related fatigue. So they found that after mark during treatment and after treatment, the ginseng is the striped line, the placebo is a solid black. And at the 4-week mark that they found there was a certain change, but not really particularly significant during or after treatment in regards to ginseng. After treatment at the 8-week mark, there was more of a change where people reported that their levels of fatigue had significantly improved. So it does where they found was helpful, and that's usually 2,000 grams per day of Wisconsin ginseng. Next slide. But one more thing about the ginseng is make sure you talk to your palliative care specialist or your oncologist before you decide to utilize that, to make sure that the psychological or mind body, which includes meditation, prayer, and mindfulness. Next slide. So another little visual interlude. So I've never met anyone so thoughtless in my life. Keep up the good work. And he says, thank you, master. So, oh, yep, thank you, 5 minutes. Next one. Should be available. If you have any questions after this, you can always reach out if I don't finish. So I wanted to talk about the categories. So when I say grade A, grade C, that's like the how strongly we would recommend, or your medical team would recommend a particular therapy in regards to what you're experiencing. So we'll talk about this moving forward. Next slide. Oh, actually, never mind. That was the slide. So basically, the grade A recommendations mean that we recommend utilizing those particular, oh, thank you. We recommend utilizing psychological or mind-body practices, particularly like meditation, deep breathing, quality of life. There is strong evidence that shows that it does help with these three. Insomnia, it does help, but it doesn't always help, which is why it's labeled as grade C. Sorry, next slide. The next category is physical or body-based, which includes things such as massage or osteopathic maneuvers. Next slide. B or C. So massage therapy, it helps some people, but there's no reason for us to recommend against it regarding mood disturbance. And for anxiety and stress, pain, constipation, you can try it if you want to. There's no real evidence that shows that it's significantly helpful. It's person by person. Next slide. Our study an aim, which the goal was massage therapy or simple touch to improve pain and mood in patients with advanced cancer. And they found that the massage therapy did significantly help in regards to those first two values, which were mood and pain. They had an immediate effect, but as to sustained effect, it did not really show much. So that's the one thing about massage therapy is you go there, you feel really good. Next, are we out of time?
We can do a couple more minutes if you're open to that.
Okay, sure. So this is a really good website I would recommend. You can just Google Moving Through Cancer and the American College of Sports Medicine. It goes through many different details on recognizing the ability of people in all stages of their cancer in regards to physical ability. So this is a really good website to utilize. Next slide. Yeah. Did we miss a slide? All right. So Live Strong is also, oh,
Sorry, I think it's lagging a little bit.
okay, no worries.
Here we go. Should be good now on the Livestrong slide.
Here we go. Okay, here's another resource for activities that you can do at home or work with your family to accomplish. And this is the YMCA. For future resource reference. Next slide. All right, last category are the combination therapies. And we'll talk about that soon. So yoga, traditional Chinese medicine, etc. Next slide. So this is a multi-center randomized controlled trial. So this means that this study occurred in multiple and the study did not know what the patients were assigned. So for yoga and sleep quality amongst cancer survivors, they found that yoga improved sleep quality, duration, efficacy, daytime dysfunction, and reduced sleep medication use, and that there was no improvement in sleep disturbance. So sleep problems are something that a significant portion of my patients complain of, and I usually recommend this. Next slide. So speaking of Chinese medicine, traditional Chinese medicine, specifically Tai Chi and Qigong, I've recommended this Tai Chi in particular to many of my patients. Tai Chi is a practice that involves a series of slow, gentle movements, physical postures, meditative state of mind, and controlled breathing. And components. It regulates the mind, breath, body's movement, and posture. And the goal is to optimize energy within the body, mind, spirit to improve and maintain health and well-being. Next slide. So why do I recommend this? So there are several studies, out of which I mentioned two over here. In a 2019 review, they looked at and the average of sessions 2 to 3 times a week for 6 to 12 weeks and of Qigong, and they found that it significantly improved fatigue and sleep quality. In 2017, they looked at 1,751 people with a variety of cancers, and they found that using Qigong was promising for managing physical and psychological symptoms related to cancer and its treatment. Next slide. Tai is a part of Qigong, so it's a subcategory, just FYI. So Qigong improves quality of life in women undergoing radiotherapy for breast cancer, and they found that improved fatigue, depression, and quality of life in that study for patients. And they looked at Tai Chi and Qigong group classes for symptoms in cancer patients and caregivers, and they found a reduction in physical distress, improvement in well-being, and just let me know when you need me to stop. I think the slides are almost to an end.
Yeah, I think we'd like for you to finish up, and then we can just do brief Q&A. The next session's scheduled to start at 11:55.
Okay.
We have about 10 more minutes for everything.
Gotcha. Well, I can end right here and you can let me know if there's any questions. I see something popped up right now.
Okay, yeah, if you want to take a look in the chat box, if anyone has questions, go ahead and pop those in there.
Yes. Oh, apparently I kept breaking up. I'm sorry about that. My internet connection has been kind of odd today. So, yes. So there are certain green teas. So there's green tea is a huge category, and there's specific green teas that can interact with certain cancer treatments. I would recommend speaking directly with your oncologist if there is if you sure that it's safe to take. Yes. So the next question was utilizing supplements such as berberine, melatonin, ECGC, curcumin, and others. So improve outcomes, live longer. Okay. So I think in regards to, I'm looking at Stephanie's question. So I can answer specifically integrative medicine specialists are doing all across America. And these results are small studies that haven't quite been fully published. And our network of communicating the results, there's not a lot of data. If there's not a lot of data, then this information is not fully communicated. So that's why I can't answer specifically about these other compounds, but is circadian rhythm disturbance. Utilizing this specifically in patients that are more elderly or fatigued, it can have sedating side effects that last until the next day. So just be careful of that. And as why I don't, the question of why oncologists don't recognize this, I think it's the oncologists working with the palliative care specialists that are integrative medicine specialists, like we have over here at City of Hope. In to determining what we can utilize. We also have integrative medicine centers, which, for example, at UCLA, which would be very like a very good resource to utilize if you're interested in things like that. So are most herbs safe to use? I would say, so based off of the research, there is significant caution that I would advise in regards to utilizing herbs. Once again, it's because you're oncologist in particular, because there have been studies that show certain herbs are actually quite dangerous to take with treatments or can interact with treatments. think this elephant in the room. So I'm reading Warren Rice's question right now. It's tempting for late-stage sarcoma patients to use supplements to try to slow their cancer, and many of us exhausted approved clinical treatments, and they're tough treatments. Do we really want to extend this by 3 months if the side effects are so debilitating during that time? Yes. So overall, I think the decision for therapy and what therapies to continue and how to continue them are very personal. So between you as a patient or you as a family member or caregiver, this is something that needs to happen as a full discussion with yourself and with clinicians in regards to effect, because open communication is one of the most important things. If they need to know your symptoms so that you can get the care for them if possible. And overall, I can certainly say from my experience as a palliative care specialist that sarcoma patients do have a lot of symptoms, and I think that it's very important to have a holistic team on your side as well to manage those to know what's out. If you aren't seeking that specialist, I'm not saying that there's miracles to be had, but I'm saying that there are things, even small things, that could impact your quality of life. And I think that to answer the second part of your question, I think clinicians, there are many clinicians that are hesitant, but there are also just as many, especially as this education rolls out over the past 10 years, I've seen a significant change in regards to these type of approaches, especially if you can prove they're research-based. So to answer Catherine Ferrari's question, what would the first appointment look like? And what would you be assessing some of the interventions done? So the first appointment, usually with any palliative medicine specialist, is about 1 hour long. That's the time that's usually allotted. And in this consultation, we usually go over whole body care. So, quality of life, goals of care. We go over things such as your family, your religion, spirituality, what's important to you in regards to your treatment. Fatigue is a big part of things, sleep, etc. So we do talk about all of those things and try to figure out what the main concerns are that you have, so that we can try to assess that. So we can assess that and help improving your quality of life. And some of the interventions that are done are, if you have pain, we can treat you with obviously the normal tablets, but if there are certain interventions specifically, we can refer you to one of our interventional pain doctors to try to give you a nerve block or an ablation procedure where, and many other procedures as well that can help minimize those type of there's we can give you different resources, such as put you in touch with our social worker team, besides social work, case management, spiritual care, anybody else that you might need that can help you with these symptoms. We can refer you for CBT, meditation, give you information on apps, things like that can help. We also have a whole center that can help with managing not only yourself, it's family. Part of the goal of providing holistic care, give you resources, give your family resources to help manage. Can you please show this slide that shows the difference between Tai Chi and Qigong?
Was this the slide or was it before
No,
this?
the one before.
There we go.
There we go. So this is more physical. Uh, and this is something you see people practicing in the park early Saturday or Sunday morning, usually older people. But I highly recommend this for younger people as well, or anyone going through this process, because you can actually see an improvement in those domains, the fatigue, the mind-body connection. You can see improvement in that moving forward. It's also very easy to do at home. You just have to YouTube video Tai Chi or even Qigong, and you can do is more psychological and physical, and they go through it's sort of like a meditation plus physical activity.
All right, there are a couple more questions in the chat box there, but I am going to have to cut you off here if you wouldn't
Of
mind.
course.
You're more than welcome to answer those questions